Classification of joints. Functional classifications are things such as synarthrosis, which are immovable joints, amphiarthrosis, which allows slight movement in joints, and diarthrosis, which are freely movable joints. Below are three different images that show where you can find these types of joints. Structural classifications of joints. Fibrous joints are consisting of or characterized by fibers. Sutures are seam-like immovable junctions between two bones, such as those found in the skull. Syndesmoses are an immovable joint in which bones are joined by connective tissue. Gomphoses, which are a specialized fibrous joint in which a conical process or peg of one bone fits into a hole or socket of another bone. Below are images that show you where you can find these types of fibrous joints. Other structural classifications of joints. Cartilaginous, which are made up of cartilage. Synchondrosis, which are almost immovable joints between bones bound by a layer of cartilage, such as the one in between vertebrae. And symphysis joints, which are places where two bones are closely joined, either forming a immovable joint, such as the one between the pubic bones in the center of the pelvis, or the ones that are completely fused. Below is an image that can show you the differences in joints. Synovial joints, also known as diarthrosis, joins bones with a fibrous joint capsule that is continuous with the periosteum of the joined bones, constitutes the outer boundary of a synovial cavity, and surrounds the bone's articulating surfaces. Below is an image that can show you a better understanding of the synovial joint. General structures of a synovial joint. An articular cartilage is smooth white tissue that covers the ends of bones where they come together to form joints. Synovial joint cavities are filled with synovial fluid, an articular capsule where each joint capsule has two parts, an outer fibrous layer or membrane and an inner synovial layer or membrane. A fibrous capsule is an envelope surrounding a synovial joint. And finally, a synovial membrane, which are specialized connective tissue that lines the inner surface of capsules of synovial joints and tendon sheets. Other general structures of a synovial joint. Synovial fluid is a transparent, viscid, lubricating fluid secreted by a membrane of an articulation, bursae, or tendon sheath. Reinforcing ligaments are thickened parts of the fibrous capsule. Intrinsic, the thickened portions of the fibrous membrane of an articular capsule. And extrinsic, which are functions to position the hand and transfer forces between the hand and forearm. Extracapsular joins bones, thickenings of articular capsules, and intracapsular, which joins bones within the articular capsule. The last part of general structures in a synovial joint are structures found in some diarthrosis. Bursae, which is a fluid-filled sac or sac-like cavity, and a tendon sheath, which is a layer of synovial membrane around a tendon. Below are two different images that can tell you the differences between a tendon sheath and a bursae.
Articular surfaces. Shapes of articular surfaces determine what movements are possible at a joint. There are shallow sockets and deep sockets. Deep ball and socket joints are made more stable by the shape of its articular surface. Ligaments. The capsules and ligaments of synovial joints unite the bones and prevent excess or undesirable motion. As a rule, the more ligaments a joint has, the stronger it is. A ligament can stretch 6% of its length, but once a ligament is stretched, it stays stretched. Muscle tone. Low levels of activity and relaxed muscles that keep the muscles healthy and ready to react to stimulation. Types of synovial movements. Origin is attached to an immovable bone, while the insertion is attached to a movable bone. Below are examples of an origin and insertion. Directional terms. Range of motion allowed by synovial joints. Non-axial or slipping movements. Uniaxial, movement in one plane. biaxial, movement in 2 planes, or multiaxial, movement in or around 3 planes of spaces and axes. General types of movement. Gliding movements are when flat bone surface glides or slips over one another in a back and forth or side-to-side motion. Angular movements increase or decrease the angle between 2 bones. Flexion is a bending movement, usually along the sagittal plane, that decreases the angle of the joint and brings articulating bones closer together. Extension is an increase in the angle between the articulating bones and typically strengthens a flexed limb or body part. Abduction is a movement of a limb away from the midline of the body. Adduction is movement of a limb toward the midline of the body. And circumduction is a moving limb so that it describes a cone space. Rotation, turning of a bone on its own long axis. Rotation may be directed toward the midline of the body or away from it. Special movements. Supination is turning backward, and pronation is turning forward. These are movements that refer to how the radius and the ulna move in your forearm. Dorsiflexion is lifting the foot so that its superior surface approaches the shin, and plantar flexion of the foot is the pointing of the toes toward the floor. Inversion is turning the foot medially, and eversion is turning the foot laterally. Special movements. Anterior and posterior movements of the mandible and jaw are protraction, which is pushing out the mandible, and retraction, which is bringing the mandible back in. Elevation is lifting the body part superiorly. Depression is moving the body part inferiorly. An example of this is when chewing, the mandible is elevated and depressed in an upward and downward motion. Finally, there is opposition. Movement when you touch your thumb to the tips of another finger on the same hand. This movement is due to the saddle joint in the metacarpal 1 and the trapezium. Different types of synovial joints. Plane joints, hinge joints, pivot joints, condylar joints, saddle joints, and ball and socket joints. A plane joint allows minimal movement of 2 flat or relatively flat bones to glide over each other. The movement is either side to side or forwards and backwards. Plane joints are also known as non-axial since there's no axis, just a gliding movement. We can rarely see this with our own eyes since these joints are found in intercarpals, intertarsals, and between the vertebral articular surfaces.
The next 2 joints are known as uniaxial joints because they only move over one axis. First is a hinge joint, which only does flexion and extension over one axis. Some of the common hinge joints are the elbow joints and the interphalangeal joints. Second is the pivot joint. This joint only allows for rotation around a single axis. Common pivot joints are the proximal radial ulnar joint and the atlantoaxial joint. Next, we have 2 biaxial movement joints. Biaxial means the joint can move around 2 axes. First is the condylar joint, which allows for flexion and extension, as well as adduction and abduction. Your wrist joints and metacarpophalangeal joints are some good examples. Second is the saddle joint, which also allows for flexion and extension, as well as adduction and abduction. The carpometacarpal joint of the thumb is a good example of a saddle joint. The difference between the condylar and saddle joints is that a condylar joint looks like an oval over the articular surface, while the saddle joint looks like one bone is sitting in a saddle over the other joint. Lastly, we have one multiaxial joint. The ball and socket joint can move around all axes. It allows for flexion and extension, adduction and abduction, and rotation. Your shoulder and hip joints are the only locations for this type of joint. A sprain is when the ligaments reinforcing a joint are stretched or torn. Most of us have all had an ankle sprain at some point. Ligaments that have been stretched or torn heal very slowly because of the lack of blood flow. A completely torn ligament needs surgery to either be sewn together, replaced with grafts like the ACL would need, or just plain old time and immobilization to heal. A dislocation is where a joint is forced out of alignment. Dislocation can happen in any joint. For example, the knee, hip, shoulder, jaw, etc. Once a dislocation has occurred, the chances of it happening again greatly increase. Cartilage tears are also an issue. This normally occurs from a snap or a pop, usually in the meniscus of the knee or from overuse from a young athlete. The tear feels the force of compression and shear stress at the same time. Cartilage is avascular, so time and immobilization are recommended. Fragments inside the healing cartilage can interfere with the function of the joint, and arthroscopic surgery is done to remove the fragments.
Inflammation and degenerative conditions. Bursitis and tendinitis are basically the same thing, but the words and locations are different. Bursitis is an inflammation of the bursa. Tendinitis is an inflammation of tendon sheaths caused by overuse.
Then we have arthritis, which is the inflammation or degeneration that damage the joints. Osteoarthritis is the most common and is also chronic. This is done by normal wear and tear. Prolonged use of the joints in the same way gradually wears away the joints. Rheumatoid arthritis is a chronic inflammatory disorder. It's an autoimmune disorder, which means that the body's immune system attacks its own tissue. Gouty arthritis is an excess buildup of uric acid in the bloodstream due to slow excretion and rapid production. Sharp crystals form, and even the slightest bit of air can be extremely painful.